Hello, this is the Oakland University Surgical Center diagram for decreasing surgical site infections. SSI rates have risen 5% in the last year at Oakland University Surgical Center. SSIs are caused by bacteria that enter the surgical site during surgery and are the most common healthcare associated infection in our surgical patients. This could be caused by many factors, including that the site is not being prepped properly, instrumentation not being appropriately sterilized, or drapes not being applied correctly. SSIs can lead to increased hospital stays of 7 to 9 days and increased costs of around $20,000 per patient. This is a figure of the skin layers of a surgical site infection. Superficial, deep, and organ involvement is very serious. To address this problem, we are proposing to implement a skin antisepsis assessment to be added to the preoperative and intraoperative checklist in the EHR. This will be mandatory. Prior to being admitted to the hospital for the procedure, patients will be asked to shower using a chlorhexidine solution that will be given to them from their surgeon's office. During admission, they will also be given chlorhexidine wipes to use before changing into a hospital gown in the preoperative area. Using this process will ensure preoperative antisepsis is completed both at home by the patient and again in the pre-op area. A scheduled order will also be added to the MAR for antibiotics to be given no more than 1 hour prior to incision, preferably as close to incision as possible. The anesthesia provider and nursing staff will work together to ensure that these antibiotics are available prior to the time they're needed. These will also be added to all safety checks performed before incision to ensure proper care is being provided and communication is happening among the surgical team. In adding these measures, we aim to improve the process of preoperative skin prep and ensure that it is done properly to reduce the risk of an SSI. Infection prevention is priority. The skin antisepsis and antibiotic administration workflow was selected due to its direct correlation in preventing SSIs. Cleaning the skin with the proper antiseptic agent prior to a surgical procedure is one of the most effective ways to minimize the presence of bacteria. Additionally, the use of prophylactic antibiotics can be highly effective. The skin antisepsis and antibiotic administration assessments on the preoperative checklist provide additional checkpoints for staff to ensure that proper care is being taken to prevent surgical site infections. Our workflow will begin with the patient registering and checking into the surgery center. This workflow will benefit the patients, but staff as well. The patient will be more prepared for surgery and spend less time in the OR. The staff will be able to have dedicated processes to get the patient ready and negate any conflict about duties. The most important decision point is assessing allergies to antibiotics and the chlorhexidine. If there is an allergy, a alternative order must be requested. Parallel processes include two nurses working together and discussing surgery with the patient, obtaining height and weight, reviewing history and allergies, starting an IV, shaving and prepping the area, and administering the antibiotic. Our workflow is concluded when the patient is taken to surgery and the prophylactic antibiotics have been administered within 1 hour of incision. Here's a review. Start, parallel processes, decision points, and stop. Our current workflow does cover many of the areas discussed today. However, it does not take into consideration or have the patient bathe with chlorhexidine at home and the antibiotics administered within 1 hour. In addition, it doesn't take into consideration delays in the surgery schedule. Our new workflow will be as follows. The patient will be registered and enter pre-op, placed in a hospital gown and their belongings secured, the patient height, weight, and other lab tests obtained. The nurse will investigate the patient history, reason for surgery, and any allergies, place an IV, assess the site, prep it with the chlorhexidine wipes. The pre-op antibiotics will be available 1 hour prior to surgery, and then the patient will be transferred to the OR. You can help prevent infection. Preventing surgical site infection is key to improving patient outcomes after surgery. Following the new processes will aid in keeping each and every patient happy and safe. Thank you.